Good morning and welcome to Webinar Wednesdays with Senior Medicare Patrol. We're really happy to have you all here with us this morning. My name is Sunny Lawless and I'm the volunteer coordinator for our SMP programs. I'll be your host this morning, and presenting for us today will be Danielle Guillory, who is one of our community outreach specialists in the state of Mississippi, and Keith Havens, who is our media outreach specialist. Today, for the April installment of our Webinar Wednesdays with SMP series, we're going to talk about genetic testing fraud and scams. Do we really need these tests? During the presentation, you're welcome to type any questions you have into the chat, but we're going to hold all of those until the end when we open things up for Q&A. We will also hold a prize drawing at the end of today's presentation. So everyone who was registered to attend this webinar prior to 10:15 this morning have been entered into our drawing for either a $25 Walmart or Amazon e-gift card. Before we get started with today's presentation, we do have to let you know that this project is supported by the Administration for Community Living, U.S. Department of Health and Human Services, as part of a financial assistance award, with 100% of the funding going from ACL and HHS. The contents are those of the authors and do not necessarily represent the official views of, nor are they an endorsement by ACL, HHS, or the U.S. government. Who is Senior Medicare Patrol? Well, SMPs are grant-funded projects, like we said, from the Department of Health and Human Services and the Administration for Community Living. All SMP grantees have a shared national identity through a national program name and logo. Every state has its own Senior Medicare Patrol program. In Georgia, Louisiana, and Mississippi, it's sponsored by AdviseWell. And our mission is to empower and assist Medicare beneficiaries, their families, and their caregivers to prevent, detect, and report healthcare fraud, errors, and abuse. And we do that through outreach, counseling, and education, like we're doing today. So before I kick things off and turn things over to Danielle, we do have a very quick polling question that we'd like to ask you. And that question is, have you ever been asked if you want a genetic test to screen for cancer or heart disease? I'm going to launch that poll. You should see it on your screen. Again, have you ever been asked if you want a genetic test to screen for cancer or heart disease? Just yes or no, and we'll give everyone a few seconds to answer. We're about at 80%, so we'll give those a few more seconds to get those answers in before we close the poll. Okay, the poll has been closed. So we're going to share those results with you. So it looks like the majority of you have not been asked if you ever wanted to be screened for cancer or heart disease. So we're going to turn things over to Danielle now, who is going to talk about genetic testing. Let us know what genetic testing is and how fraud or scams might occur with this type of testing. Danielle?
Good morning. So as Sunny said, we're going to talk about what genetic testing is and how you can protect yourself from these frauds and scams. So the Center for Disease Control describes genetic testing as a series of different tests that can provide information about various genetic disorders or your potential risk to develop certain types of cancer. There are several different ways that the sample can be taken. The most used is a cheek swab, but they can also do a blood sample or a spit sample. Next slide, please. So genetic testing frauds and scams are one of the biggest issues that Medicare beneficiaries are facing. The scammers are offering these tests for free to Medicare beneficiaries, but then they turn around and bill Medicare for the tests that are not medically necessary. And in most cases, the beneficiary or their personal physician may never receive any results. Genetic tests should only be ordered by your personal healthcare professional when he or she deems that medically necessary. Next slide. So there are many different types of genetic screenings and tests. The most used, of course, is cancer screening, but they also have DNA screening, hereditary cancer screening, and those are just a few examples. Remember that genetic tests should only be ordered by your personal healthcare professional when he or she deems that medically necessary. Next slide. Scammers may come to your local senior centers, senior apartment complexes, or health fairs that you might be attending. And they may ask you questions about your family, your personal health care history, such as, has anyone in your family had cancer? Have you had cancer? They will then offer to perform a genetic test that they will claim will tell you your chances of developing cancer. They're always going to tell you it's free. The problem is they're then going to ask for your Medicare information. So if it's free, they don't really need that, do they? Next slide. One of the new latest growing genetic test fraud trends focuses on cardiovascular genetic testing. And we've heard reports of scammers calling Medicare beneficiaries, claiming that their cardiologist or their healthcare provider wants them to have this test and offering to send a free kit. In reality, their providers never made any such request. And y'all all know that if your provider wanted you to have a genetic test, they would tell you that in person and they would not mail you a kit. Next. So a company offering free or at no cost to you testing without a treating physician's order, and then they're billing Medicare. That's just one example of cardiovascular genetic testing fraud. Another is a company using telemedicine, and that's where they're calling you over the phone or arranging for an unrelated physician or a teledoc to order those tests for you, somebody you've never seen. The next is billing Medicare, usually thousands of dollars, for a broad range of cardiac genetic tests that you did not request and more than likely will never even see the results from. Or a company that calls you stating your doctor or your cardiologist requested that you have this test done, and they will send you that testing kit. Next. So when are the genetic tests covered? Because you can have genetic tests, but those need to be ordered by your physician. So if somebody has stage 3 or stage 4 cancer, when the test is medically reasonable and necessary. So the federal regulations define medical necessity as services or items reasonable and necessary for the diagnosis or treatment of illness or injury or to improve the functioning of a malformed body member. When it's ordered by your treating physician, federal regulations define a treating physician as the physician who furnishes a consultation or treats a beneficiary for specific medical problems and who uses the results in the management of the beneficiary's specific medical problem. Tests not ordered by the physician who is treating the beneficiary are not considered reasonable and necessary. When one or more coverage requirements are met for colorectal cancer genetic screening, there is no other Medicare coverage for genetic testing as a screening service. When a treating physician orders the test as a diagnostic service and uses the results to manage the patient's conditions. Next. So what happens if Medicare denies that genetic test claim? Genetic test bill to Medicare cost on an average between $9,000 and $11,000. If Medicare denies the claim, you could be personally responsible for the entire cost. Remember, these types of tests should only be ordered by your personal health care provider who is familiar with your specific situation. Next. How do you stop genetic testing fraud? Let me give you a few things you can do to help stop genetic testing fraud. And the best way to avoid becoming a victim of genetic testing fraud and scams is to be sure that your doctor has assessed your healthcare condition. Although Medicare covers many genetic tests for diagnostic use, it only covers one preventative genetic test to screen for cancer. Do not give your personal information to strangers. Always review your Medicare summary notice or your explanation of benefits and report strange or suspicious items to Senior Medicare Patrol. Next, please. So now I'm going to turn things over to Keith, and he's going to share the 3 keys to success in preventing Medicare fraud, errors, and abuse. Keith?
Okay, thank you, Danielle, and I want to welcome everybody to our webinar. And a lot of you I know have probably heard the 3 keys before, but it is important to review these every time because they are really very important in being successful in preventing fraud, errors, and abuse. So if we go to the next slide, we'll see what the first key is, and the first key is prevent. Now, a key component of preventing is protecting. We want you to protect your personal information, as this is the best defense against healthcare fraud and abuse. You should share your Medicare number only when it is necessary, such as at a doctor's office or your pharmacy. And you should only carry your Medicare card when you know that you will be needing it. Now, a lot of people, they always ask the question, well, what happens in an emergency situation? Don't I need my Medicare card on me if I have to go to the emergency room or something like that? Well, rest assured that you will always be admitted to the emergency room. You do not need your card on you to be admitted. And you always have the opportunity after you've been in there that they can, you can, give them your card number or somebody can bring it and all that. So don't worry about not having your card on you for an emergency. And then remember that Medicare, and this goes for any federal agency, Medicare, Social Security, IRS, they're never going to call you and ask for your information. Medicare has your Medicare number. They don't need to call you and have you verified, or they don't need to call and ask, what is your Medicare number? They know it already. And then also we want you to get in the habit of keeping records of all your Medicare medical visits and any procedures that take place or any type of medical equipment that is ordered. And this leads us to the second key on the next slide, which is detect. So the best way for you to detect that there's some potential fraud going on, or just detect any kind of errors, is to review your Medicare summary notice or your explanation of benefits. If you have a Medicare Advantage program, you will be getting what we call an EOB, explanation of benefits. as opposed to the Medicare summary notice, the MSN. Your MSN is going to be mailed to you by Medicare every 3 months. And like I said, with the Medicare Advantage plan, you will receive an EOB, or your explanation of benefits, after you have received some kind of healthcare service. And what we want you to do is to compare these statements to your personal records and look for certain items that should be red flags that something is not right. We want you to look for any type of medical appointments that you did not attend or you were double billed for. We also want you to look for any type of medical equipment, such as braces, catheters, or diabetic supplies you did not order or receive. Now, recently, across the country, we've had a lot of reports of people either receiving urinary catheter supplies or being billed for these and never receiving them. And so always look for any type of equipment that you never received, you didn't need, you never ordered, that type of thing. And then the third key in the next slide is report. If you suspect that you have been a target of fraud, please report it. It's very important. This will help you and others at risk for healthcare scams. You know, one of the ways that that scammers are, brought to justice is that we give the Department of Justice reports on, what type of scams that we're getting, that people are calling us about. So that that may help them open up an investigation. So it's very important that you report any type of suspected fraud or any type of abuse that you see. Now, a lot of the ways that scammers are going to contact you, of course, is through your phone. And we want you to know that if you get any type of call, the first thing you should do is you look, you see a number and you're not familiar with this number. It's not anybody you know. It's not anybody that in your contacts. The best option for you is just not to answer the phone. If it's somebody important, they're going to leave a message and then you can call them back. But if you do answer the phone and you can tell right away that this is not, anybody that you need to talk to, then just hang up immediately. Don't engage with them. I know that you've heard about these cases where they try to get you to say yes. They ask you they may ask you if you are so-and-so or, whatever, but they want to record you saying yes. So the best practice is just first of all, don't answer, but if you do, hang up as soon as you realize that it's a robocall or it's somebody trying to scam you. Now, if you do see something on your MSN or your EOB and it looks suspicious, or you have a question about it, you don't remember doing any of this, the first step is for you to call your healthcare provider or your plan and see if they can't straighten that out. Now, if you aren't comfortable calling your provider, or if you do call them and you aren't satisfied with their response, then you can call us at our toll-free hotline number that you see right there on the screen, 877-272-8720. And I think it's a good practice if you will enter this number into your contacts on your phone, and you can put it under SMP or report fraud or whatever. So in the future, if something comes up, you can always have access to that number. Okay, on the next slide, we want to talk about how you can get involved in helping protect the seniors in your community. Now, our volunteers receive training on the basics of Medicare and healthcare errors, fraud, abuse, and scams. And in addition to giving presentations and attending community events, our volunteers participate in bi-monthly webinars and various training opportunities throughout the year. It also just happens that this week is National Volunteer Week, and we always have something for our volunteers during this week. Volunteering for the SMP program is extremely flexible and is done on an as-needed basis. You are offered opportunities and you have the option to decline if you're not available. And you get to determine how often you would like to participate. And we also want to mention that this is a great volunteering opportunity for couples. We have had couples team up to volunteer, give presentations, and attend community events. So, you may not be comfortable getting in front of a group and giving a presentation, but we have community events where what you do is you basically pass out information and maybe be available if somebody has a question that you can answer. If you think that volunteering for SMP is something you might be interested in, give us a call, again, at our toll-free number, 877-272-8720. We would be more than happy to send you one of our volunteer information packets and answer any questions you might have about the process. You can also go to our website, which I want to talk about now is our social media. And we have information on our website about the volunteer process and things you will do and that type of thing. But we want you, and a lot of you I know probably follow us on Facebook, and we appreciate that. We also have a YouTube channel where you can get a lot of good information about all of our, what you can do to protect yourself from fraud. And we also have our podcast, and we have both video and audio versions of our podcast. You can see the video version on YouTube, and you can go to Spotify or Apple Podcasts and see or listen to the audio version of these podcasts. Now, I want you to look at this object here on the screen, this black and white. It's got all these dots and everything, and you wonder what the heck is that? Well, that's a QR code. And if you have your phone handy, what I want you to do is to open, if you have a smartphone, iPhone or whatever, open up your camera on your phone and just point it at that screen. So it kind of fills up the screen. Now you'll notice that there's a yellow button there at the bottom of your camera, of the image. If you just click on that, it'll take you to all of our social media links that we have, and you can just click on any one. If you want to go to our Facebook page for your state, or our YouTube page, or the Sip and Learn podcast, you just click on that. And that's a good way for you to access any of our social media. And also, as you probably know about our Facebook, these are really good resources. We, like to put out scam alerts and different events that are going on that you may be interested in. So please, follow us on Facebook if you haven't already, and use that as a resource. Okay, and the next slide, we're all in this together. It's important that we protect our Medicare because we want it to be around for us, from now on. And one of the ways we can do that is by preventing healthcare fraud in the first place. So we want you to feel comfortable in contacting us and reporting potential fraud, or like you say, questions that you have, by using our toll-free number, or you can visit our website, and it gives you a contact form on that on the website where you can report fraud if you'd like to go about it on that platform. And if you haven't been to our website in a while, you should visit it, because we have refreshed that, and it also has a feature where it can be viewed in different languages. If you have somebody that speaks that English isn't their first language, this is a good resource for them. Okay, on the next slide, I think I'm going to turn this back over to Sunny, and I appreciate y'all coming today for the webinar.
Yes, thank you. Thank you, Keith and Danielle, for that great information on genetic testing fraud and scams, and Keith with all the information about the SMP program and Prevent, Detect, Report. So coming up next month, our hot topic for May is going to be telehealth fraud and scams. So the whole month is kind of dedicated to talking about virtual healthcare scams. During the pandemic, there was a lot of us who were doing those virtual office visits, and some of us continue to do so now. And of course, those bad actors have figured out a way to, use that for fraud and scams. So we're going to dedicate the month of May to that topic. So our next webinar is going to be on Wednesday, May 31st at 10:30 a.m. So just be on the lookout for an invitation to register for that soon. And then, of course, now it's time for us to do our drawing, our prize drawing. So this is for the prize to win either a $25 Amazon or Walmart e-gift card. And you do have to be present to win. Let me open up the names. Here we go. And I'll give that wheel a spin. And it looks like Mark Becker is our winner this morning. So Mark, I'll be reaching out to you soon, and we will find out which gift card you want and get that over to you as soon as possible. So thank you for joining us. Let's get things back over here to the slides. There we go. All right, so now it's time for our Q&A. So before we wrap up today's presentation, we'd like to open it up to you all if you have any questions. You can raise your hand. If you look at the photo here, the go-to control panel, there should be a little hand button. You can raise it, and then we can unmute your line, and you can ask us a question if you like about today's topic or about the SMP program. Okay, well, I'm not seeing any hands raised, but you have our toll-free hotline number and also our website, where you can also go and report fraud if you have any questions about that. This will conclude our presentation today on genetic testing, fraud, and scams. You will receive an email later today with a link to a short survey. So we would really appreciate it if you would take just a few moments to complete that survey. It helps to let the Administration for Community Living know how we did today. And thanks again. We appreciate you joining. So take care, everyone, and we hope to see you again soon. And thanks, Danielle and Keith, for our for presenting today.